Okay, today is March 7th, 2025. My name is Advika Rajiv, and I'm with the Houston Asian American Archive. I'm talking today with Dr. Aisha Siddiqui, the founder and executive director of the nonprofit Chat. Thank you so much for this opportunity to speak with you about your journey.
Thank you very much for the opportunity. I really appreciate it.
Of course. Just to get started, can you please state your full name and where and when you were born?
My name is Aisha Siddiqui. I was born in Karachi, Pakistan.
Thank you. Could you describe your neighborhood in Karachi?
My neighborhood in Karachi. So there were a few neighborhoods that we moved from one place to the other. I don't exactly remember the very early on, like very when I was the house I was born in or anything. But my first memory of the house that like my childhood memory, you can say uh, like preschool and elementary school age memory is of a house that was like a 3 bedroom, 1 bathroom house, and we were like 3 siblings and our parents. It was like a an average kind of neighborhood, not very rich, not very poor, just average medium kind of living. My mom did not work, and my dad used to work, and we were the 3 kids in that house. So 5 people lived in that house. It it's actually not a 3 bedroom house. It's a 3 room house where one room is a bedroom, and the other can be used as a dining room or a secondary bedroom for the children. That we, in our case, it was, and a living room, and we used to call it a drawing room. And at that time, back home, it's called a drawing room for some reason. I think due to the British influence, many things were different. Does that explain? And it was backing to a park, so there was a park that we used to go and play. And uh, I used to be a very athletic child, or a very playful child, whatever it's called. So I used to go out, play with friends. There were a lot of friends in the neighborhood. So life was much, much, much simpler and very joyful. Little things were gave us big joy. When my father come home from work, he would bring a bag of fruits or some goodies, and the kids just would run to him, and we just loved it.
That's amazing. Thank you for sharing. You mentioned you have three siblings. What was the age gap and how would you describe your relationship with them?
So at that time, we were 3 siblings, like me, and then my brother, and then my sister. And then later on, much later, after like she's uh, 17 years younger than I am. So my baby sister was born. So this is how the 3 sisters are. 3 siblings are. Me and my brother, who is one of the twins, but one of the twin passed away when he was a baby. So my brother is 1.5 years younger than I am, and then the other sister is 1.5 years younger than the brother. So she's 3 years younger than I am, and then my baby sister is 17 years younger than I am.
Thank you. What were some of the values your parents instilled in you while you were growing up?
So education was a must, honesty and being nice to others. So we have religious beliefs. We belong to a religion, and that's why our parents installed this religious beliefs in us, and then we were expected to follow them very strongly. And like all religion, the religion teaches you to be nice to others, be honest, never to cheat, never to steal, be polite to others. So all those were the things that our parents also gave us. But one thing that my mom was strongly advocating was education for all, and education for girls. So that's why all of us went to school and college, and you know, are professionals. So I think that's one thing. And our religion also tells us to get education, no matter how far we have to go to get education. So that's also a religious value, we can say. But that was one thing that my mom was very strong about. And then we had to, yeah, and then we had to keep our home, the small home. It was not small for the average at that time, but from now that I'm explaining it, it sounds like small. uh, but we had to keep it very clean, ourselves very clean, rooms very clean. So cleanliness was also a value, and being nice to other and being polite to others. Like I said, all those the religious values that every religion promotes. Having being a good citizen and a good human being.
Amazing, thank you. Since you mentioned education, can you take me back to some of your early educational experiences in elementary and middle school? What schools did you attend, and were there any teachers or experiences during this early schooling that inspired you academically or non-academically?
Yeah. So school was good. I was always very competitive child. I had to do very well in my class. I had to do very well in sports. We had, like I said, we had a park at the back of our house. Like our house was backing a park, and we used to have sports and athletic days there. I used to participate in that, and my effort was always to be number one. And same thing in education. um, my parents helped us and supported us, so they wanted us to do well. And like I said, I'm very competitive myself in education, so I always wanted to do very well. And in our system, there were grades like first, second, third. Students here too, like in high school, kids are valedictorian, salutatorian at that time in every grade, even kindergarten, first, second, third. So I would never imagine being second or third. So I always had to be first. So I worked hard, and um, there was structure in the household. There was discipline in the household that the kids would do their work and excel in school. But among all of my siblings, I think I was the most committed student or dedicated student, and did very well in school. That's what I remember. And I also participated in sports and debate in all my school years. Teachers knew me very well, and then they encouraged me. I was at one point in my schooling, I remember that I was not doing very well in math, but then my teacher would really um, focus on me and sometimes be hard on me and say, how could you not do very well in math? So I got so good in math that I can never forget that teacher. I can never forget her name. I can never forget how she pushed me. So I was very, very good in math, and that made my future education achievements possible. My mom was also a teacher later on. At that time, she was a stay-at-home mom when we were little, but then later on, when we got older, she became a teacher. So my mom was a teacher all her life.
That's amazing. Thank you for sharing. It's great that you had such influential teachers in your life.
Yeah.
Were your parents supportive of your interests, and did they ever push you towards specific interests or fields of study?
My parents were very, very supportive, and I think that's what reflects in my personality, the confidence I got, and the belief in myself I got from my parents. They always believed in me, and they always supported me and my siblings, everyone. They but whatever we wanted to do in our careers, they were supportive. My mom wanted me to be a physician, but and at that time I thought, yes, I wanted to be a physician, but sometimes things do not happen the way you want it. And in Pakistan, sometimes things, especially in higher education, so there are 10th grades in school, first through 10th grade, and that's the 10th grade is called metric or matriculation, and it is SSC certificate, which is secondary school certificate, and then the next two are HSC, like higher secondary school certificate, which is intermediate, which is grade 11th and 12th. And after grade 12, if you score very well, then you go to you can get into medical school or engineering. Otherwise, you have to pick other careers. So during my higher secondary school certificate, like my intermediate years, those two 11th and 12 years, there was some, I'm not sure, some kind of um, natural disaster that happened, like flooding or something. So anyway, the way it worked, that they lost all our papers without grading, and then it was heard that they just gave us grades randomly. So long story short, I did not score the numbers that I was supposed to score, and therefore I did not get into medical school. But that's what my mom really wanted to, but they never discouraged us, or they never were disappointed, or I was never disappointed in what if we did not do, because whatever, she was sure and my parents were sure that whatever we do in life, you will do good. And that's how it has been, and it's still now that they are. My father passed away, but my mother is very supportive of what I do, and same thing with me and my kids.
Wow, thank you for sharing. Speaking of that event, was there any historical event or narrative that stayed with you from first year of like history classes or history textbook?
I'm not sure about the history classes or history textbook, and to tell you honestly, I'm not a. I when I was little in elementary and middle school and even high school, I was not a big fan of history class because I felt that our history stopped at the time when Pakistan was created or formed, or even before that. So it wasn't current history, and I was very much interested in the current history. Where are we now? What are we doing now, and how it connects to the history, the ancient history. So the history books that we were given, or the history classes that we had, were not to all the way to the present. So that was something that I didn't like. I wanted to see how we are connected to the past. But the thing that I can tell you that I still remember, and which is something that I can never forget, that I saw two wars. One war was when I was very little, so I do not have a very strong memory of it. But the other war, between Pakistan and India in 1971, I clearly remember it. It was very, very scary. And then all of us all the neighbors and friends, people from all these houses, and we were still living in that house that I explained. And I forgot to tell, there was also a small backyard in the house. So everyone will gather in the backyard, like all the women and children in our house, when the bombing and shelling started. And then we had a trench dug outside of our backyard in the park area. A trench is a place, for those who do not know, it's like a big kind of big kind of, I mean, I know the word trench only, like you dig it underground and then cover it on the top with wood and dirt and sand and everything. And then there is a secret way to go inside in that trench. And so all the women and children will go in one trench, which was next to my house, attached to my house. And then men would gather in another house and they will watch the situation. And then we would see the bombing start or shelling starts, and then the shells start falling in the park there where we play. And then our moms will quickly, secretly, just we will you know bend and go inside that trench with the pencils in our mouth and the cotton balls in our ears, so the bombing won't affect them, and we would stay there until the bombing continues. So that event, I can never forget.
Oh wow, that must have been terrifying. I'm sorry you had to go through that.
Yeah, yeah, it's just, I mean, the thing is that we came out alive and we were fine and we moved on is a big thing.
Mm. How old were you then, and how do you think you versus your parents versus your siblings, you all dealt with this differently if you did?
So my siblings were even younger. The baby sister was, of course, not born, and my siblings were younger. And um, my brother, a playful little boy. So I'm not sure how. I mean, all the kids were very, very scared though. And especially when you have to hold a pencil between your teeth so that the teeth don't clutter, or have to put cotton in your mom's putting cotton in their kid's ear, is kind of a scary in itself. So I think they were all very scared. We were all very scared. And then our moms would say, just pray to God that everything is fine. And then we just come out of it fine. So I remember my mom is the person who gets very, very frightened and nervous. So her face changes, her face turns pale, and her eyes show the fear. And I can never forget her face. So she is the most frightened. And of course, you can imagine being a mom, if she knows that I have my three kids with me, my husband is outside, God knows what's going to happen. So the fear is there, and that's what they felt.
I see. Do you recall how the war concluded or how news was shared during this time?
The news was shared on the radio. People would have the transistor radio, the wireless kind with the antenna which catches the news. So everyone had their transistor radios. They would carry it everywhere. These are small radios, like a little a size of you can say a size of an iPad. And then there is an aerial that comes out of it that you pull and it catches the sound waves. And then there are stations with the needle. You set those stations where the news is coming, and then we will get all the news through that. There were no phones or cell phone. We did not even have landlines. And of course, there were no cell phones. And that's how we got the news. And I think the war ended because in this particular war, India got the territory that they were looking for, and Pakistan, uh, they said they accepted it. They accepted their defeat. They put their weapons down, and then the war ended.
I see. Thank you for sharing. Moving a little bit more into your immigration and moving to the US, what motivated your move to Saudi Arabia before the US?
So my husband was working in Saudi Arabia. Pakistan economy is not the greatest, and it was not the greatest at that time too when we were there. And people used to move or try to find jobs in other countries, mainly Middle East, like Dubai, Abu Dhabi, Qatar, and then Saudi Arabia. So my husband got a job in Saudi Arabia. He's a chemical engineer, so he got this job and he moved to Saudi Arabia. And then we got married, and he sponsored for my visa, and later on, I joined him in Saudi Arabia. We lived there for about 11 months together. Like my husband lived there, of course, longer before we got married, but together, when I joined him, we lived there for 11 months. And then in the meantime, his green card immigration visa was approved because his brother, who was living in the United States at that time, had sponsored his visa, so it was approved and he could apply and got the visa stamp. So that's what he did. And since he got married in that time, during the time when the visa was applied and approved, so I got the visa automatically with him. So that's how we got immigration to the United States.
Awesome. You worked as a math and science teacher in Saudi Arabia. How would you compare the educational systems in Pakistan, Saudi Arabia, and the US?
The education system in Saudi Arabia and in Pakistan was quite similar at that time. But US, I haven't taught in the US schools, so I cannot really compare it to the US schools, except that I see what my kids had done in the schools when they were going to schools in the US. But it was uh, it was called the British system, and like I said, the for in the United States, the system, the grading system, and the report cards, all these are different. The kids are given their grades differently, but in Saudi Arabia and in Pakistan, it's the British system, and then there are grades like every class, every exam, the children are declared first, second, third, and then A grade, or in the United States, for example, the A grade is 90 and above, and in our system, there was not an A or B grade, but over 70% points, 70 out of 100 used to be an what was the word? Distinction. It was a distinction, meaning that you did very, very well. Anyone who scored over 70%, they got distinction in that subject. For example, if I got 70 or above, like 80 or 90, then I got a distinction in math or any subject that I got those those grades. So, and then the medium of education was English, like people spoke like in Pakistan there were both English medium and Urdu medium schools, but I went to the English medium school, and in Saudi Arabia this particular school was English medium, the medium of you know uh, education. All the books were in English, and kids would speak English or Urdu, because the principal or the person who had started this school was from the subcontinent. She was not Middle Eastern, she was not Saudi, and she started this school because a lot of people who migrated to Saudi Arabia from that region, from the subcontinent, their kids did not know Arabic, and without knowing Arabic they couldn't go to schools, the local schools. So she started this school for expats and people who were in whose kids could not speak Arabic. So they came to this school, and the medium was English, teaching and conversation.
Okay, that makes sense. How has working as a professor or a teacher in all three countries influenced your teaching style or content?
So, like I said, I didn't teach in school here, like the grade
Hmm.
school, but then I got my own education here at UT School of Public Health. I did my master's and my doctorate in public health. So I saw how teachers teach here, or how professors interact with the students, and how the classes are structured. So that's what I modeled after when I was teaching. And I really enjoyed my teaching. I really enjoyed connecting with the students. And I think it was a great experience, and it helped me a lot in being uh, a teacher. This interacting with the students helped me to decide how I want to interact with them, or how I want to teach, or how I want to engage the students. So my teaching experience was a great experience, and I wish I could have uh, done it more, but because of the nonprofit that I created, I couldn't continue to teach as much as I wanted to. But it was a great experience. I can never forget it, and I would, if I had a chance, I would go back.
Oh, that's really great to hear. Where in the US did you move to first, and were you able to find a solid Pakistani American community there?
No, we moved to West Virginia. It was a small town in West Virginia. The name is Parkersburg, and we had to uh, go to Parkersburg because my brother-in-law, who sponsored us, used to work and live in Parkersburg. So we took a very, very, very long flight, because there were no flights from Pakistan or Saudi Arabia to Parkersburg. So we came to Europe. We took the flight to Europe, from Europe to New York, from New York to Pittsburgh, I believe, and then from Pittsburgh to Parkersburg. Very, very small airport, like a one small room, and very small plane. And there was no Pakistani community except the brother-in-law whose house we stayed in for about a month, and then we moved to Chicago. uh, in Chicago, there was a huge Pakistani community. There were grocery stores. There are neighborhoods where you feel like you can see people like yourself. So Chicago was very good. I really enjoyed it. Not that I didn't like Parkersburg. It is a beautiful place. It's called Heaven on Earth, and it was really heaven on earth. It's just beautiful. And then Chicago was very, very nice. But then after 4 years in Chicago, we moved to Houston. And Houston's Pakistani community and the Houston's scene, food and groceries and places to go is just out of this world. It's just beautiful. So that was the journey.
Awesome. Thank you for sharing. Did you experience any culture shock, and was the US what you expected from the info that you had prior to coming here?
Oh, yeah. It was a huge cultural shock because when I moved to here, in Parkersburg, my brother-in-law and his wife and his family, we stayed with them for a month, like I said. So I missed my family. I missed my community. The culture was very, very different. Like I said, in my home country, we would go to the neighbors, we would just chat. Everyone knew each other, but here people are reserved and everyone just like say hi from a distance and not really connected to the neighbors as I was used to. And then my sister-in-law and my brother-in-law told me that I cannot wear the clothes that I brought with me because I will look very different and people are not appreciative of it, which I don't know was true or not. It's just the perception I got from my family, like my host family. And then you always have to dress up in Western, otherwise people will pick on you. And then food choices that we had to make. There was no halal food that I'm used to eating or I prefer eating, or actually the only meat that I eat is halal. So we had to rely on vegetables a lot, unless my brother-in-law would just go drive hundreds of miles and get some animals slaughtered and then bring them back. So there was not the meat was not readily or easily available. So either do that or rely on vegetable or seafood. And then the spices were not available. There were no grocery stores where we could go and get the groceries like I'm used to or I'm raised on the South Asian food. There was no option of a restaurant. I remember I didn't even eat pizza for the longest time, even though it's vegetarian. I mean, it has cheese, but I did not know if the cheese was halal or not, if it comes from pork, which is not that is permitted to me, and then what kind of enzymes are in there, what dairy products are in there. So we did not eat out, period. There was McDonald's, there was French fries. I don't know what kind of oil they used to fry the potatoes in. So it was very limited choices. And then we were afraid of eating something wrong. So we did not eat out at all for many, many, many years until until we moved to Chicago, and then I started calling the companies. For example, I called McDonald's and I asked them what oil do they use to fry their French fries, and then I called Pizza Hut, and then I would ask them what kind of cheese they use, like what are the ingredients. The biggest concern was pork or lard that we wanted to avoid. And then if it's cow's milk, it's fine. If it's if the fat is generated from like cow or goat or sheep, it's fine, but not lard. So those were the challenges early on. And one thing that you may not even think to ask, because no one can imagine right now, there were holidays like for right now there's Ramadan, So, and after Ramadan is Eid, which is after 30 days of fasting. And Eid is a big holiday. So, we did not even have the opportunity to call back home on Eid day because there were no direct lines. So, I would call the operator and I would request the operator to connect my mom's number. Like, I would stay online and the operator will try to connect. And then, since it's Eid, many people are trying, the circuits are busy, so the operator would call, uh, try 2 or 3 times, and then they would say, "No, ma'am, I cannot try any further. The circuits are busy. Please try later." And then that was like heartbreaking that I am alone here with my husband, just me and my husband, and our families are not here. And then we cannot even talk to our families or our parents on Eid because the phone lines are so busy. But we relied a lot on letter writing. So my parents and my friends and my family would write letters. We would write letters. I remember standing outside, when the mail carrier, at the time when the mail carrier arrives, I would just stand outside and wait for the mail carrier if he's bringing a letter for me from home. And then I hated Sundays at that time because the mail carrier didn't come on Sundays. So I knew I cannot expect a letter on a Sunday. So I hated that aspect of Sunday, that why the mail doesn't come on Sunday. So I could receive a letter from my mom in my home. So those were the kind of things that we dealt with at that time. I know you asked for food, but there were other things too that we did not have.
Definitely. I'm sorry your first couple of years in the US were so difficult. I'm glad you were able to find other ways to connect with your family.
Yeah, it's not that it was the first couple of years. I think it was everywhere. Things started changing at that time. So it's not that we moved to Houston and things were better. It's not that. It's the time that changed. I'm sure that there are a ton of South Asian families are in Parkersburg in West Virginia now. There are tons of restaurants. There is halal food everywhere. So it's not that Houston had this thing at that time and others did not. It gradually came into existence, or it gradually started everywhere. And of course, Houston is ahead because it is a big city, and many people come from different parts of the world to Houston, so there are more opportunities.
Yes, that makes sense. Thank you for sharing. Moving a little bit on to your education, what colleges did you attend and what did you study?
In the United States, I
Anywhere in all of your college experience.
okay, so in Pakistan, like I said, I was pre-med, and then I went to Karachi University and did my degree in biochemistry. And then when I moved here, I was thinking to do like go back and go to pharmacy school, but the issue was that the pharmacy school is not as flexible as some other programs are. You cannot pick and choose courses. You have to go, like, the curriculum is set and you have to be a full-time student. And at that time, by then, I had two little kids, so I was debating what to do, and then one of my friend, who was a physician from Pakistan, she said, "I'm doing a master's in public health." And I said, "What is that?" She said, "It's MPH, and you get a degree in public health. A lot of physicians who come from Pakistan or India and other parts of the world, they do that public health degree." And I said, "That sounds very interesting." And since I was pre-med, and I'm always interested in community health and public health and being engaged with the community, it was very interesting for me. So I explored more and I said, "Okay, I'll apply with you." And then I did my GRE, and then I applied with her. Interesting thing is that she was not accepted into the program and I was. And that was my first introduction to public health, and I really loved it. And that was UT School of Public Health. And before that, I was taking some evening classes at the junior college because I was thinking to do pre-pharmacy courses for getting an admission into the pharmacy. But then when I applied for this MPH and I started doing it, I loved it. And then I decided that this is what I want to do and this is my calling. And I did my at that time I was thinking to go back to Pakistan and help people after getting my education here, especially maternal and child health. So I did my master's in public health and with the focus in international and family health. That was the major area of my interest, international and family health. And then after finishing that, I started working at the Houston. No, actually, before I graduated, I started volunteering at the Houston Health Department, and then I started working at the Health Department after graduating as an epidemiologist. I worked there for 5 years, and then I realized that I still want to get more knowledge because that was my public health job directly related to my education. And that time I felt the urge to learn more and to know more if I want to connect with people and if I do good and make some impact. And I applied again at UT School of Public Health for a doctorate in public health, which is DRPH, got accepted and started my degree part-time. And then later on I resigned from my job at the Houston Health Department and became a full-time student and finished my degree. When I was doing my dissertation, I sought out the South Asian community in Houston to do to talk to them, to do interviews and key informant interviews and focus groups. Uh, of the South Asian community to find their challenges. And my dissertation was just a small portion of it, that what is the impact of acculturation or lack of acculturation on women and their physical activity in the South Asian community. But that's when I decided that this is what I want to do. Like, I want to continue to do that, work with this community. They are very isolated, they are ignored, and they definitely need help. But after during my DRPH, no, I think it was after, I'm sorry, I'm just mixing up the dates. But after my DRPH completed, I started teaching at University of Houston downtown and St. Thomas University. And while I was teaching, I kept thinking about the community that I worked with, the data I collected, and finalize everything. And then um, I didn't know how to work with that community, how to help them. I was just on my own, connected to them. I would help them with whatever they need, but there was this urge to do something more. And then it I realized that without having a nonprofit or without having an organization at my back, I cannot go very far. So I talked to many organizations about their challenges and maybe having a program for them, but it didn't work out. And then finally, I ended up making a nonprofit myself. So it was not my intention out of school to just create a nonprofit. It is a result of all my efforts that I did to help that community, and then realize that without a nonprofit a platform, I cannot go very far. And then since I was not able to collaborate with any other agency, then I ended up creating one.
Yeah, it's
Does
really
this make
amazing hearing about your journey to building your nonprofit, that it's sort of built from everything that you worked with in the past. Um,
Yes, yes, very definitely.
I was curious, you said you did research that focused on the South Asian female demographic. Was there any conclusions or findings that you found that were surprising or different from what you expected coming in?
So when I was picking topic for my dissertation, I told my advisor, Dr. Stephen Linder, that uh, the burden of diseases, chronic diseases like diabetes, hypertension, and all that is higher in the South Asian community and in women. So that's why I want to focus on that. And he said, you know that already, Aisha, that the burden of the disease is higher. So you need to dig deeper and see what is going on here or why is that. And then I And then I said, okay, we will look at acculturation, like what makes people uh, happy or unhappy, what kind of lifestyle they have that is impacting their health. So that's how we started with that. That's how my dissertation topic came into being. That, and then with that we saw that when the people are living in their shells, sort of, and they are isolated, they do not feel that they belong to this community, they do not feel that they belong to the culture, or they are treated like a second class citizen, or they feel that they are treated, not necessarily that they are treated. If they feel that they are not equal, or this is not home, they're going back to home sometime, and so the home that they are living in for 1, 2, 5, 10, 20, 30 years is still not home, then of course they are not happy. And that also causes mental health issues, that causes like sadness and depression. But at the same time, those mental health stressors make it physical health issues. So that's what the result of that research, and that the finding, and from those the qualitative data that I collected.
Okay, that makes sense. Thank you. You mentioned earlier that you worked as an epidemiologist.
Mhm.
Compared to present day in the aftermath of the COVID pandemic, how has your perspective, if at all, changed from working in the infectious disease landscape to living through a global pandemic?
So what do you mean by perspective change?
So, since you worked as an epidemiologist, maybe you had a
Correct.
perspective of how maybe the world was prepared to deal with a pandemic, something like that. And then after having lived through it, how has that sort of changed?
Okay. Thank you for clarifying. So, of course, as you all saw and we saw, that world was not prepared. I can tell you one thing that will explain it better. So, when the pandemic started, I was in visiting Pakistan. In It was early 2020. I remember I came back from Pakistan on February 7th, 2020, and then during my stay in Pakistan, I don't know if it was a week or 2 week stay or something, a short stay, I heard about this disease, and everyone was talking about this disease, and then they said that it started and it's impacting everyone. I don't remember. I think they called it COVID-19. That part I don't remember. They called it COVID or some other name, and then I heard the stories about um, this is starting from eating monkey or all those kinds of things in a third world country. And I said, what is this going on? And I have not heard about it. And I didn't take it seriously. I was laughing. I said, they're always worried about one thing or the other. I don't know what's going on. And I have a cousin whose son was studying abroad, and she said the school's closed and he is back home, and they live in Dubai. And then when I arrived at the airport, the day when I was coming back, when I arrived at the airport, I saw there were signs: check your temperature. If you have a fever, don't get into the plane. And very, very, I mean, it felt weird. What is going on and why I don't know anything? And I was talking to my family back home all the time. I was connected, and then no one told me about it. The biggest news I got from my family at that time was the helicopter crash of the um, basketball player. Do you remember? Uh,
Yes, Kobe Bryant.
Kobe Bryant. So that was the biggest news that I got at that time. And I was like, my son was extremely upset. He called me, Mom, did you hear? So there was no COVID in the United States at that time. There was no COVID news, nothing. Uh, and then at the airport, this is what I saw in Pakistan about the temperature and all that. And the temperature was being checked when you were boarding on plane. And then I took Turkish airline. I arrived in Istanbul for the connecting flight. And then the person on the desk, he checked my passport and he said, when did you go to China? And I forgot that I had been to China, because it was like a transit for one day. And I totally forgot, long time ago. So he said, when did you go to China? And then I said, I haven't been to China. No idea why he's asking. And then he showed me the step. I said, oh, I'm so sorry. Yeah, this was a transit. We were going to Australia, and then in the way because it was Air China, then I stopped there. Anyways, I came back here, and then even then in the US, nobody was worried. I didn't see a huge issue. We were planning to go back. So my trip to Pakistan was a short trip, and then the whole family was going back to for an Umrah, if you know, in Saudi Arabia and Pakistan in March. And we are still planning that visit. And we were thinking, and since I was in Pakistan and I saw that, and I told my family, I don't know, there is something going on, and then the thing is not the same. Everything is not the same as it was before. There is something big going on. So I don't know if we should go or not, but we still were buying our like plane ticket and visa and everything, and we got the visa for the Umrah. That's the surprising thing. We got the visa, and then we are booking our flights, and all of a sudden we heard that that Saudi government closed the Umrah, the whole process. People cannot go to Kaaba, they cannot perform the Umrah. They shut down the mosque. And that's when we seriously thought, what's going on? And at that time, I'm thinking, this is Houston, and I have been in everywhere and came back, and nothing happened. And the plane was fine. There were no masks, nothing. And I'm thinking, think about New York. People go to, you know, New York, and like the airports are so busy. People from all over the world come to New York every day, every hour, every minute. So how much earlier people were exposed to COVID by the time they found out? So we already had that pandemic in the United States. It has already spread here, but it was not noticed. And to my surprise, we still had the rodeo that year. And I was like, why are we having a rodeo? There is such a huge crisis, and rodeo is like the best breeding ground, and people are so close, they're eating together, they're with animals. Why are we having rodeo? And I kept thinking, and I told my family, nobody's going to the rodeo in this year. But we had the rodeo. So we took that COVID very lightly, and we were not prepared at all. From that epidemiologist perspective, we were not prepared. We were not mentally ready, and we had no idea what is going on. I think some other countries in the world were much more prepared than the United States. As far as the preparation or the mindset comes, we were at the bottom at that time. So I think that's where it came from, the way it spread in New York and other big cities. And of course, people come to Houston, and people come to LA and other big cities too. But New York is, uh, the main area. Everyone goes to New York first. So, and day in, day out, thousands of people are coming in and out of New York's airports and going to different parts of the world. And thinking back, uh, at the same time, my daughter was very, very worried. She said, one of my friends was perfectly fine. She's a physician. She all of a sudden she got sick, and then now she's on ventilator. No idea what had happened to her. And then, of course, it could very well be COVID, but it was not diagnosed. So that was the epidemiologist's perspective. Does it make sense?
Yes, absolutely. It definitely seemed like we took a really long time before we got started on preventative measures.
Yeah, and we had no idea what was going on.
Yeah. What makes you most passionate about your work at Chat?
The community. The
Okay.
community is the thing. My heart was always in the community. I am a big advocate of e- equity and equality in health, and with through my dissertation and through my experiences in the United States, and I saw that it's not equal. I remember this one lady. She called me once and she said, "Can you help me find a job?" No, sorry. Can you help my son find a job? He lost his job. I said, okay, what does your son do? She said he had worked at a cell phone store and that's what he's looking for. And I said, okay, I know someone at Fry's, the big electronics store. I can talk to them if they're hiring. And she said, yeah, that would be good, but he really wants to work on Harvin, like in a private cell phone store. I said, Fry's is better. They offer health insurance and other benefits. She said, yeah, but I don't need it. Health insurance is not permissible in my religion. And ironically, both her and I have the same religion. I said, why would you say so? She said, yeah, insurance is not good, so I would not my son would not accept it. I said, that's amazing because if you don't have health insurance, how would you go see a doctor? If you get sick, how do you get treatment? She said, oh, we go to Bentop. So people did not even know how to take care of themselves. People did not know or do not know how to manage their health insurance or uh, their health. Like during COVID, I know many, like thousands and thousands of people did not get a COVID vaccine because they did not want to go to the doctor. They didn't want to pay for that vaccine. They didn't want to even go to get free vaccines or leave their homes for that, and they said that they can treat themselves. The other thing, one time I got a call from a school, HISD school, and they said we have these little kids who come to school and they come in their pajamas and sometimes they smell, which is very difficult for teachers and other students. Can you talk to the family and explain it to them because they don't speak English? The grandparents are taking care of the babies. And I said okay, and then I started to find out what's going on. So the grandparents are were taking care of the babies because the mother, a single mother, was in prison. And I said, why is she in prison? Say, because um, one of the babies, the youngest baby, uh, got burned. The mom was taking a shower and there was a candle in the house, and somehow the older baby, which was like 1.5 year old or so, or a year old, the older baby pushed the candle, and then the youngest baby, the infant, got burned. And people told the mother in that community of immigrants not to call police because they will arrest her for negligence, and not to take the baby to the doctor, just put Vaseline. The mom put Vaseline on the burnt baby, and a day or 2 day or 3 day later, the baby died. And then the mom was in prison. Anyway, so it's just that lack of knowledge, not knowing what to do, not knowing where to get help, how to get help. They get deeper and deeper into their problems rather than coming out of those. And that really breaks my heart, like more than anything. And I just want to help those people. It's just to tell them there is, I mean, if you cannot get help in these United States, if you cannot get education, if you cannot get medical help, then there is a serious problem in your knowledge because there is everything for everyone here.
Well, yeah, thank you for sharing. How do you measure the impact that chat has on its clients?
Measure the impact is we see
Hmm.
that the community is thriving. We see the students are happy. We have our social emotional learning programs in schools, and a lot of times students say, can we only come to chat program and not go to the school because we love it here? We see that the kids who are coming to our after school program, not knowing any English, to singing songs in English and speaking English. We saw women happy. So it's just all that. And during COVID, we went door to door for vaccination. People were not coming out, and they were not getting vaccines. So our community health workers, who are trained community health workers who come from the same community that we serve, they went door to door with the nurse and vaccinated people. And so all these things are, you know, give us the give us the uh, belief that not just the numbers from the survey, not just that, but people's trust, and that happiness gives us the contentment or belief that we are doing a good job for this community.
That's amazing. Thank you.
Yeah, sometimes I don't have the words. You can understand that English is not my first language.
No, not at all. With the recent public policy changes, such as removing DEI programs and limiting like funding for other social services, how do you see that affecting Chat and its goals for its future?
So chat is not an independent organization anymore. We have merged with Mid America Arts Alliance. We merged in 2023. So I'm not the CEO of Chat anymore. I'm not the I'm not the decision maker, the top decision maker of Chat anymore. I'm the director of Chat, which is a program of Mid America Arts Alliance. And I tell, jokingly, I tell everyone that I think I'm the only person who is very happy at her demotion, because now I have someone to go to when there is a problem. We have a director and we have a senior vice president over me. So Chat is not the decision maker, and Chat is not a freestanding nonprofit anymore. We are a program of Mid America Arts Alliance, and obviously Mid America Arts Alliance has policies that we are all are following.
Okay, makes sense. With your involvement in the immigrant community, how concerned are members whose status may be in limbo in response to the administration's immigration policies?
So apart from like vaccination, like when we have a nurse with us and we are giving COVID vaccines or early childhood vaccines or all those things, we mainly work with refugees. So we do not work, a big portion of the community that we serve is not immigrants, it's refugees. And most of the refugees come from the countries where there is war, and there was like where United States was involved, and these people are brought in legally and they have legal work status or green cards or things like that. So I haven't heard a big, I haven't felt a big unrest or something in that refugee community. Currently, we are working with mostly Afghan refugees and Burmese refugees. Burmese are not new. They came long time ago, but one of our community health workers is Burmese and she can communicate with them. And we are working on a reproductive health project with the Harris County Health Department. So she's very vital in that, to connect with the Burmese community. And then we have two community health workers who are from the Afghan community, so we connect with them. So to answer your question, most of the people that we are working with right now are not the ones who are undocumented.
I see. Do you think there is a short-term or long-term impact even on those who are documented in coming and moving to the United States?
I have heard, but I don't know. Even when yesterday I was somewhere and I did not see the person, but I was hearing someone introducing someone to other people, and they said this lady came from Afghanistan 2 days ago or something. So people are still coming, and right now the policy change is not. Uh, final. So things are in a moving stage. So no one knows exactly what's going on, including myself.
I see. Makes sense. Moving on, in 2019, Chat partnered with multiple local Houston muralists to create the Gulfton Story Trail. Can you
Mm-hmm.
talk about the inspiration behind this project and some of the logistics of bringing together such a comprehensive endeavor?
So in 2019, then Mayor Turner announces, I think it was before 2019 that he announced, 2017 or 18, the Complete Communities Initiative. And Chad was in Gulfton. We were a nonprofit, one of the nonprofits in the Gulfton area. And Gulfton is one of the complete communities, one of the communities in that initiative, which Mayor Turner decided that we would improve. So this funding came from that, the mural funding came from that uh, complete um communities initiative, and the name was Visit My Neighborhood. And the idea was to use this funding. It was, I think, $85,000 funding, to use this funding to make something in the neighborhood, to beautify. And one of the agencies would get it. So all the agencies will like write a proposal and submit it and see who gets that funding uh, to make visit like some beautification of the neighborhood of the Gulfton area under the Visit My Neighborhood grant. So all different agencies proposed different projects, and Chad proposed the murals. And then the fund came from the hotel occupancy tax from the mayor's office of cultural affairs and Houston Arts Alliance. So Chad got this funding, and we had proposed that we will make a series of 12 murals. It's called the Gulfton Story Trail. We will engage the students who attend chat program in the community, whoever wants to participate. The kids will write poetry, and then the mural artists will take that poetry and paint a mural based on that. So that was the idea. And we had uh, workshops with children, and they wrote poetries, and then we had a call for artists. The artists came, and the proposal was, our proposal that I wrote was that we will collaborate with other agencies. So then one agency was involved with the poetry workshops, one agency was involved with the call for artists, so we were working in collaboration. And then artists came, we had a meeting, and then I explained the project to them, and then told them they could pick the poetries. And all the mural artists who came for this project were very, very engaged with the community and wanted to give back. So their compensation was very little as compared to what they charge for the murals. And then they painted those murals. So this is how the Gulfton Story Trail came into being.
That's amazing. And how did you come up with the idea for murals specifically, and how did they help advance the message of healing for the underserved community?
So if you see, the mission of CHAT is to improve the health and well-being of immigrants and refugees through education, arts, advocacy, and access to care. So obviously, the arts is a big part of it. We have always believed in art and the power of art for healing and therapy. So the kids will learn to speak English when they speak, or the women will learn, and the language access and being to like the whole acculturation process. Everything comes with time, but art is like instant healing, and art can tell the stories which are otherwise not possible. It's on the wall. So that's how we thought of these murals, and people see themselves in those murals. And a lot of people have not been to museums or art galleries who live in the Gulfton area, and that is their chance of seeing the art there. You cannot even imagine. One time we had our Chat Academy kids, the after school homework program, Chat Academy kids participate in the Houston Marathon in 5K. So that day we took about 40, 45 kids in the morning to downtown to run 5K, and they were looking at the buildings as something just completely out of this world. They had no idea of those tall buildings. They had never seen downtown. They have never been outside of their neighborhood. And some of those kids were born and raised here, not just came from somewhere, but they did not have those opportunities. So then this art is coming to their community. They are seeing themselves on the wall, like through that art, images that look like them, images that represent them, and then it speaks to them and about them, you know? So that's what the Girlfriend Story Trail is.
That sounds incredible. I saw that Representative Jean Wu was one of the speakers at the Gulfton Trail celebration.
Mhm.
What would you say the relationship between like public service organizations like yours has with legislation in Houston?
Amazing, amazing. Both Jean Wu and uh, Council member Edward Pollard are very, very supportive of our work. They have always been there. uh, it is really remarkable how Jean Wu finds time out of his busy schedule to attend our events or to meet with us if we ask and to support us whatever way he can. And same thing with Edward Pollard. He's very, very supportive of our work. And whenever we needed something, he would just go out of his way to help us, or his office will go out of their way to help us. For example, we lost the apartment lease for chat office and the programming space, and we were not able to find an office space, especially in the apartments. So, council member Edward Pollard helped us to find this new office where we are in. So, and they make connections for us, they make introductions for us, and sometimes even funding when it's like the city initiatives or grants, the fundings that we can apply for, we get them.
Yeah, wow, it's so nice to hear that the whole community is sort of coming together to build this up.
Yeah, yeah, definitely.
Moving a little bit away from, I guess, career community, did you ever face any discrimination as an Asian American in your field?
You know, I would say that I face discrimination because sometimes things are subtle, and I'm a very positive person, very optimistic person. So even if things are not the best, I don't feel that this is this is something that I would want to pay attention to, because we have so much support in the community that even personal level, I know I have dealt with it, especially after 9/11, and if before 9/11 too, I have dealt with it. But it's just that I think if we just keep focusing on that, then I will miss the bigger picture. Yes, there are instances. Yes, there are instances when I was asked to go back home, or my kids were asked to go back home, and they look at me and they say, "But this is my home, Mom. Where do I go?" So it's just these things happen, but I think my mission is much bigger than that. And those who are doing it do not know better. And I'm very, very thankful for the opportunities that I got in life, very thankful for the education that I got, the support I got from the faculty in UT School of Public Health, and then all the support that I got for chat. So I would not focus on anything that is just little or a distraction, because the mission is big. And like I said, from Jean Wu to Council Member Edward Pollard to local nonprofit organizations and all the other places that supported us, I would think that the support is much bigger. And then Mid America Arts Alliance now, they are I mean, they just saw the value of the work that we were doing and the organization that I had created, and then they decided to just support us. It's huge. Now Chat is doing the same work. The work has not changed, the focus, the mission, the vision has not changed, but we got more resources. through Mid-America Arts Alliance. So that is big.
Yeah, that's amazing. I really appreciate that insight. It's really good advice for anyone put in that position. Um, Moving on a little bit to family and personal life, can you tell us a little bit about your family and your children? Do they follow in your footsteps? Like, what are they doing now?
Uh, my husband, like I have a degree, like a doctorate in public health. So I'm a public health professional. My husband is a chemical engineer. He works for the city of Houston, and he's working there, I guess since 1989, long, long time. And ever since we moved to Houston, actually we moved to Houston because he got this job. So ever since we moved here, uh, he's working for the city of Houston in public works and in engineering. We have two kids, a daughter and a son. They both went to University of Houston main campus honors college. They went to UT McGovern for their medical school, and then my daughter did her residency at UTMB and then her fellowship at Harvard, and my son did his residency at Columbia University, like Medical Center, New York, and he did his fellowship at Texas Children, and he's currently working at MD Anderson Cancer Center. And my daughter moved to Dallas, and she is in an ophthalmology practice in Dallas.
Okay, that's amazing. To you, how important is it to educate your children on your own ethnic heritage when raising them?
Oh yeah, it is very, very, very important. Never to uh, lose your roots, because that's where the tree is built, like is formed on. So they speak Urdu fluently. They follow the religious footsteps, that the teachings of the religion. So we have not lost anything. And that's also very good here in the United States, that you can practice your culture, you can practice your religion, but at the same time, you can get the best education if you want to. And that's the best of both worlds that they got. And me and my husband were very, very supportive of them. We tried to do our best in raising them, and we feel that we feel that we were successful in that.
That's awesome. How do you stay connected with your extended family and siblings?
So my parents moved to the United States in 95, I believe. So my parents moved here, my two siblings moved here, just one sister is in Pakistan. We talk to each other. Now the phones are not that kind of commodity that you don't have access to, so there is WhatsApp free calls. I remember when I used to call um, Pakistan in early on, when the operator said that the circuits were busy. The call 1 minute call was $5. Like the phone call to Pakistan was $5 a minute. Now it's free calls. There is FaceTime. Then letter writing does not exist anymore for that reason, and then we visit each other. So yes, my extended family, some of my extended family is in Pakistan. A lot of my relatives and my immediate family is in Houston or in the United States, mostly in Texas. My husband family is mostly in Texas and United States. So we are not in the same situation. The family is here too. Some siblings are back in Pakistan. They decided not to move, but the nieces and nephews and all those. So we have a huge family in the United States.
Okay, that's really nice to hear.
Mm.
Um, what are some of your like hobbies and interests outside of your career?
Spending time with family, that's the number one. Spending time with my immediate family. And then I used to like cooking, but I don't cook anymore as that much. I mean, I cook, of course, but not as much as I used to because the kids have moved on. It's just me and my husband. So if I cook a lot, then we will have to eat a lot, which we don't want to do. But travel is a big hobby. We like to travel and we travel a lot. So that's another thing.
Awesome. Thank you for sharing.
Yeah, and I
Um,
also
Very
focus
good.
on fitness. I'm sorry. So exercising is also something that I have a treadmill sitting in my family room in front of TV. So I just hop on it as much as I can whenever I want to. Just hop on it or go to the gym or swimming pool. But fitness is also something that I like activity, physical fitness activities that I enjoy.
Perfect. Thank you.
Thank you.
On to some final questions about your identity. How do you identify yourself ethnically?
South Asian. I'm a Pakistani Muslim.
Okay. And what do you feel most proud of?
Most proud of that I am a good human being who cares about others, and my religion gave me the values that I could follow and be where I am.
Okay, thank you. When and where do you feel most at home?
Uh, I feel at home in my home here in Houston. In Yeah, at home. Whenever I'm at home, I feel happy, and this is home.
Okay, thank you. If your children watch this interview in the future, what's a message you want to give them?
Um, I would tell them that I would not change anything. I would still do everything the same that I did for their upbringing. And I'm really proud of them, the way they turned out. It seems like my efforts did not only pay off, but I got bonus. And I just would want them to know that, and they know it very well because my kids are adults now, that we care for the community and they do the same. So just keep doing it. Keep up the good work.
That's beautiful. Thank you for sharing.
Yeah.
Is there anything else you would like to add that we have not covered yet in this interview?
No, I think you did a great job. Thank you very much. And thanks for the opportunity.
Of course. Thank you so much. With that, I'd like to conclude our interview today. Thank you again so much, Dr. Siddiqui, for talking with me. I really enjoyed hearing your story, and I appreciate you taking the time to share with us.
Thank you. Thank you very
Of
much. You have been
course.
very nice.
Thank you.
Nice talking to you. Okay.
Okay,
Bye.
I am
Oh.
going to